Introduction: Restraints for pediatric psych patients. Why is this topic necessary? Restraints are devices that physically prevent someone from free movement and mobility. Restraints are used for patients as a last alternative when other factors have failed. Verbal de-escalation, reorientation, medications, diversional activities such as music, TV games, and discussing the need to cease the behavior. Restraints are used to prevent harm to the patient and/or staff, but many times restraints themselves can cause harm to patients. It is important to understand the correct policy and procedures for restraints to ensure consistency and patient safety. Importance of the problem. What can go wrong? Though used to prevent harm, restraints themselves have the ability to do great harm, which is why it's so imperative to know the importance of proper restraint use and diligent assessment while the patient is in restraints. Restraints have caused physical and emotional harm up to and including serious injury and death. When a person is restrained, they have limited ability to protect themselves from harms, such as accidental aspiration, movement in such a way that causes injury, difficulty breathing, etc. Delayed treatment for medical emergencies when restraints cannot be quickly released from the patient also causes harm. Importance of the problem. What can go wrong? Part 2. A serious concern with the use of restraints in the pediatric psychiatric unit is that even with policies and procedures in place, lack of education and training, errors and accidents still happen, as previously mentioned. Anytime a patient is harmed is a serious sentinel event that must be studied to determine a root cause analysis and solve the issue. Research article number 1. Restraints are designed to be a safety intervention, although restraint and seclusion have been shown to affect children and staff adversely. Physical injuries, psychological trauma, and deaths have been reported. Reducing the use of restraints ultimately reduced risk of harm, trauma, or injury when alternative methods are used, such as chemical restraints, diversion, one-on-one observation, de-escalation techniques. Given this information, careful decision-making and following all policies can limit the use of restraints in the first place. Research article number 3. There is a large impact on staff members involved in the application of restraints versus those not involved. It is important for staff to be involved and participate in all debriefings to understand the need for restraints and to ensure proper protocol was followed. It is important that staff utilize proper personal protective equipment when caring for the child psychiatric patient requiring restraints. This is to protect both the patient and staff members to reduce the risk of harms. Failure to properly assess restraints can lead to prolonged times the patient is in restraints when they could actually be removed. Prompt removal of restraints is of utmost importance because the shorter duration a patient is in restraints, the less likelihood of patient harm. SMART. My plan to implement regarding the evaluation and education on the use of restraints is designed to eliminate injury and emotional trauma to the patients and staff. The fact that injury up to and including death is a serious problem with the use of restraints due to lack of education and training regarding use and release of restraints to ensure these actions are in the best interest of the patient and only used when absolutely necessary. The goal is achievable because education and training are based on evidence-based practice, which has been shown to improve outcomes. We will know the change is an improvement based on data obtained after implementation of the plan, which will show a decrease on the use of restraints as well as reduction and eventual elimination of harm to patients and staff. In addition, data will be obtained for any adverse events and analyzed in debriefing as to a root cause of the problem and steps that need to be implemented in future situations to prevent harm to patients and staff. What changes to make? My plan to ensure compliance and safety with restraints is a multi-step approach to educate staff on their policies and procedures regarding appropriate use and assessment of restrained patients, and a debriefing for every time restraints are applied, to educate staff on the reason for the restraints, verification by another nurse to ensure restraints are on properly and reviewed every shift for all patients in restraints, and what progress has been made to safely remove the restraints as soon as possible. The successfulness of my solution for restraint safety can be evaluated by gathering the data of the use of restraints in comparison to proper use of restraints and prevention of injury before and after the implementation of my plan. Results. Due to time constraints, the plan has not yet been initiated. However, the evidence shows that adherence to the Bradley Center's policies and procedures provide guidelines and protocols for the use and discontinuation criteria for manual restraints for the pediatric population. My solution to ensure the prevention of injury and adverse effects works along with these policies to ensure they are being adhered to. By evaluating the use of restraints, rigorous education, and debriefing with the entire unit when restraints are applied, continued, or released will further ensure the safety of patients and staff and reduce adverse events such as injury to the patient.